The load and shift test is testing for both anterior and posterior instability, or more appropriately testing for the available range of motion in each direction. Again, you want to stabilize the shoulder with your mama cat grip, and you want to come in with a nice lumbrical grip here and grasp the humeral head. And so here what you want to do is, this can take some practice, but you want to really get a feel for how much movement is at the joint. So I will tend to first compress the joint a little bit and often reseat the humeral head back centrally where it wants to. Oftentimes you'll find that it sits forward with most of us. So I'll try to kind of find a centered position, and then what you do is you can apply a posterior force from there and see if there's any available movement. And then you can do the same applying an anterior force. And typically you're going to find more laxity anterior than posterior in most of the population unless your patient has a history of posterior dislocations. So what you want to do is the glenohumeral surface is a little bit of a bowl shape, so you're not just shearing straight forward and back, you're moving in a slight bowl shape as you glide posteriorly and anterior, but again, this is all very small. When you're doing this, you want to make sure that you sink into the tissue so that you really can feel like you're against the bone, and you're really just stabilizing with your scapular hand, and with the humerus you're going to slide posterior and anterior. And you can imagine, for grading this, once you reset the humeral head, you can kind of imagine where a line would be, and you can estimate 0% or 25% of a posterior glide versus sometimes 25–50% of an anterior glide, and you can use that to estimate how much movement is available.